The Behavioral Health Workforce Education and Training Program aims to develop and expand the behavioral health workforce through improved training. The goal of the program is to support interdisciplinary training, integration of behavioral health with primary care, and increase the number of field placements and internships with a focus on serving persons in rural, vulnerable, and/or medically underserved communities. The BHWET program provides stipends to graduate-level students in the University of North Dakota behavioral health programs.
I'm originally from Southern California, and I had the pleasure of my last year while at UND of being part of the Behavioral Health Workforce Training Program, and it provided the opportunity to work with the indigenous community in North Dakota out at Elbow Woods, the MHA Mandan Hidatsa Arikara Nation, and it's really set the foundation and stage for my career, and I'm grateful for that opportunity.
I am getting my master's degree in social work at UND. I'm working with folks from towns I've never heard of. My connection to that rural healthcare or that rural service point is been primarily in researching what's out there and how to make it work for people who are going home.
Well, since I'm living rural and my heart, that's where I'm from. I was born and raised there, so I want to stay working in the rural community.
I think in psychiatry, mental health, whether you're rural or whether you're in city, I think working with your interprofessional group is a big deal.
I feel like this course should be part of a requirement, for every profession, because when we go to the world over there, sometimes we are not so respectful to other professions, thinking, physicians maybe think, what the psychiatric nurse practitioner know, and then psychiatric nurse practitioner say, I'm much better than social worker, I can do these things, No, we are different, we have different roles, we have so much to offer to each other and learn from each other, We are not individuals, we are a team.
One of the things that I learned, and that I think a lot of the other students learned, is for some reason you have this notion that we all just know what each other does. That I know what nurses do, that I know what residents do, OT, PT, speech language pathology, that I don't really need to ask. And when we get all into a setting like that, we realize we're more unsure about what other health disciplines do than we realize.
You can't communicate with somebody who you don't even know what they do. We get together with the doctor, the nursing staff, OT, PT, speech, nutrition, recreation, case management, and we staff a number of the patients each day to talk about progress. We have a meeting like that weekly on each patient that's here.
It's way more comforting to be able to go into a job saying, yeah, no, I've done telehealth, or yeah, you want me to go to a remote location, one day every 2 weeks or something like that. Having this experience to find out the kind of the ins and outs and realizing that's something that's very doable.
Learning about the grant, it absolutely made it possible. Without it, it wouldn't have been feasible. I would have elected for something closer.
I would like to just say thank you for this opportunity to be part of this grant.
It's just an amazing gift in multiple ways, but obviously financially it's huge.